I'll discuss with you today how do I approach assessment of face. When a patient comes to me and asks me, Doc, I look fine, but what can you do to improve my looks? So I'm discussing with you today a patient who came to me with the same discussion. She said that, Doc, what can you do to enhance my face? So I'll show you the image. This was this patient of mine. Now, she came to me and she said that, Doc, what can you do to improve my face? So the first thing is we look at the proportions of the face. If you see her forehead to the tip, the base of the nose, from base of the nose, the tip, and from tip to the chin, the distance should be same. But if you see, her chin was small. So this tells me that we need to improve her lower part of the face because that part of the face is smaller. Now, this is in frontal view. When we see her in the profile view, what does it show me? So, if you see her face from the profile view, it gives you an idea that how much chin is retruded back. So, if you see, the ideal ratio says if I draw a lip line from the lower lip, the chin should be just 2 millimeter behind this line. So if you draw this line, you will see that there is a distance of at least 6 millimeter retrusion of the chin. So the chin was not only smaller in height, it was also set back. So we need to bring her chin back. To correct this deformity, there are two options. One is chin fillers. There are synthetic materials, injection in the chin, 10 minutes procedure. You see the result immediately, but it lasts for an year or so. If some patient wants a permanent result, then we do a chin implant surgery done from inside the mouth, no scar ever visible on the face or neck. We give an incision inside the lip, make a pocket on the bone, put an implant and come out. 20 minutes procedure, permanent result. Daycare, of course, patient goes back home the same day and they eat and drink from the same day. And do you want to see the impact of this result? I'll show you, and then you will realize what a powerful procedure this is to change your overall looks. You see her now, you can see the impact. This face has gone a lot better. She looks much more proportionate. Her chin is in proportion to her face. The chin has come out and she looks much more aesthetic. You see the impact of this face. This face looks much more proportion. You see the upper 1/3, the middle 1/3 and the lower 1/3 are in right proportions. You will see that her chin has come out. It looks much more aesthetic. The face proportions has totally changed. And you see her from profile view or side view, and you will see her jawline has improved, her chin has come out, and her face looks much more aesthetic. You see from the profile view as well, and you can see that chin has been brought out just 2 millimeters behind the lower lip line. So that's what good assessment of face means. She did not come to me asking for chin augmentation. She just came to me saying, Doc, what can be done to enhance my looks? And I'm sure you can appreciate the changes. She's ecstatic and so are we for her. That's what precise assessment of face means. If you have any questions regarding facial aesthetic procedure, please connect with us. Me and my team are always there to guide you scientifically.